Ambulance crews are the frontline troops in Los Angeles' battle with COVID-19. Brutally long hours and the stress of trying to rescue so many sick people has put tremendous strain on emergency medical technicians like 30-year-old Jennifer Mueller.
I work 24-hour shifts, and we leave station at about 7 o'clock in the morning, and we don't get back until about 6:30 the next morning. So it takes a toll on our bodies. Everyone's exhausted.
EMTs rarely get a break or even a moment to rest.
It's a lot on us. A lot of the times we don't get lunches because there's just so many calls going out.
Hospitals are so overstretched that ambulance crews have to wait for hours to wheel their patients into the emergency room. There's simply not enough space, not enough staff to take them.
It's typically like long wall hours at the hospitals. You're waiting for your patient to be admitted to get off the gurney. Typically waiting anywhere from 2 to 3 hours.
At ambulance dispatch centers, the calls for help just keep coming.
30 years, I've never seen any kind of call volume like this. Not even with the riots, it was not like this.
At one time, 9 calls sitting, so that's 9 people that are in distress.
The country's largest mass vaccination center opened Friday at Dodger Stadium in Los Angeles. Other large vaccination centers are launching across the state as officials seek to rapidly ramp up what has been a frustratingly slow effort.
4,000 people will get the vaccines today. We hope that's the goal. This is just day one. The idea of getting to 12,000+ will be significant.
While hospitals and ICU admissions have begun to decline in California, the Centers for Disease Control issued a sobering outlook. The new, much more transmissible and fast-spreading coronavirus variant, first discovered in England last year, could become the predominant strain in the U.S. by March. The agency warned that would lead to more cases overall, more deaths, and more pressure on the healthcare system's overworked heroes. Rob Reynolds, Al Jazeera, Los Angeles.